So we are back here. And in our previous video, we looked at what anxiety is. Then we look at anxiety and fear. I did the same. We made a difference between them. We also looked at what anxiety disorders are. And we said that some levels of anxiety is good for every human being because it improves our performance and helps us do well in some areas of our lives. But when anxiety is too much, it's too extreme, when it is overwhelming, and it can be detrimental to our lives. That's why we talk of anxiety disorders. What are the types of anxiety disorders we have? According to the Diagnostic Statistical Manual of Mental Health 5 by the American Psychological Association, the following are the types of anxiety disorders. We have specific phobias. Specific phobias. We have social anxiety disorders. We have panic disorder. We have agoraphobia. Then we have generalized anxiety disorders. I want to go over the types of anxiety disorders. We are looking at specific phobias. We're also looking at social anxiety disorder. We have what we call panic disorder. We have what we call agoraphobia. We have generalized anxiety disorder. Then we're saying that anxiety disorders are the commonest of all psychiatric disorders. I think in the previous video I said that they are mental illnesses. And here I'm saying that they are the commonest of all psychiatric disorders. We're saying that 28% of people report some form of anxiety disorders, and they are the most common form of phobias. Now let's look at what we call specific phobias as a type of anxiety disorders. Specific phobias. What are they? Specific phobias are an intense, irrational fear of something that poses little or no actual danger. Okay, that thing you fear, that thing you are anxious of, poses little or no danger at all, but you have an intense fear of that thing. The thing can even harm you, but you have irrational fear of that thing to the extent that it brings you untold hardship or distress. A specific phobia involves an intense, persistent fear of a specific object. Please, let's underline the word specific object or situation that's out of proportion to the actual risk. The object you fear or the situation you fear is out of proportion to the risk that thing can even pose to you. For instance, some people are afraid of spider. Ask yourself, what risk does a spider pose to your life? Some people are afraid of rats. Some people are afraid of mouse. Some people are afraid of a lot of things. So these things we are afraid of, they pose little danger to us. So we call them specific phobias. We're saying that unlike the brief anxiety you may feel when giving a speech or taking a test, specific phobias are long-lasting. They are long-lasting. They cause intense physical and psychological reactions and can affect one's ability to function normally at work, at school, or in social settings. Some people fear mouse. When they see mouse, it will affect their mood the whole day. They go to work and they are not able to work as they should. Some people are afraid of lizard. Some people are afraid of centipede. And when they see one, it affects their life terribly. This is what we are talking about. We are saying that specific phobias are among the most common anxiety disorders. They are among the most common anxiety disorders. Common categories of specific phobias are fear of situations such as airplanes. Some people are afraid of airplanes. Some people are afraid of enclosed spaces, or they're even afraid of you going to school. Some people are afraid of nature, such as thunderstorms, lightning, or even heights. You put people on top of a story building, they can't even look down. They are afraid. They are afraid of height. And so that's also a specific phobia. Some people are also afraid of animals or insects. Some people are terribly afraid of dogs. Dogs will not even come close to them, then they are dead already. They are terribly afraid of dogs. Some people are also afraid of millipedes, centipedes. They are afraid of wall jackal. They are afraid of a lot of insects, a lot of animals. They are afraid of them. They see these animals, it puts intense fear or intense anxiety in them. So these are examples of specific phobias. Some people are afraid of blood injection or injury. Okay, afraid of blood injection or injury, such as needles, accidents, or medical procedures. Some people are also afraid of vomiting, loud noises, or clowns, or even choking. So these are common categories of specific phobias. So that's what we call specific phobias. In other videos, we'll look at specific phobias in detail, looking at their causes, their effects, and how we can treat them. But for now, I'm only trying to help you to understand what these specific phobias are. We move on to what we call social anxiety disorder. Social anxiety disorder. And I asked some 3 or 4 questions here. Are you extremely afraid of being judged by others? You answer that question for yourself. Are you extremely afraid of being judged by others? Are you very self-conscious in everyday social situations? Do you avoid meeting new people? Are you afraid encounter any form of social situations? If you have been feeling this way for at least 6 months, and these feelings make it hard for you to do everyday tasks, such as talking to people or at work or school, you may have a social anxiety disorder. Social anxiety disorder is also known as social phobia. A person with social anxiety disorder feels symptoms of anxiety or fear in certain or all social situations, such as meeting new people, dating, being on a job interview, answering a question in class, or having talked to new people or to people. The person we're talking about is afraid that he or she will be humiliated, judged, or rejected. And this is the basis of social anxiety disorder. That the person who has this disorder is afraid that when he goes into any of these social situations, he or she will be humiliated, he or she will be judged or rejected by other people. And so the anxiety comes in, the fear comes in. The fear that people with social anxiety disorder have in social situations is so strong that they feel it is beyond their ability to control. The fear or the anxiety is so intense that they feel that they cannot control it, or it is beyond their control. They feel helpless in such situations. And as a result of this situation, it gets in the way of going to their work, attending to school, or meeting new people, or they will even avoid all forms of social situations because of the fear they have. Some people with this disorder do not have anxiety in social situations, but have performance anxiety instead. So another form of social anxiety disorder is performance disorder. When they are on stage, when they are giving talk, when they are performing, then they have intense fear, or the anxiety will come. We'll call it performance anxiety instead. So they feel physical symptoms of anxiety in situations such as giving a speech, playing sports, or dancing, or playing a keyboard, or any other thing. So my dear friends, social anxiety disorder can be terrible. It can prevent you from meeting new people. It can prevent you from accepting responsibilities. It can prevent you from actually taking on challenges that has to do with any social situation. In the next video, I think in another video, we will talk more about that. Look at the causes and how you can overcome that disorder if you happen to have it. Let's look at panic disorder. Panic disorder. Panic disorder occurs when you experience occurring unexpected panic attacks. You experience reoccurring unexpected panic attacks. We have to explain what is meant by panic attack. According to the DSM-5, panic attack is an abrupt surge of intense fear or discomfort that peaks within minutes. It is a sudden surge of intense fear of discomfort that peaks within minutes. Within a short time, you have a sudden fear, a sudden discomfort that comes to you within few minutes, then it goes away. And everybody will feel panic attack once or twice in their lives. The one who has panic attack will feel sudden, overwhelming terror that has no obvious cause. You feel sudden terror or attack, and it has no cause. You can't even know what is causing that attack. It's so sudden. Within a few minutes, you have that sudden attack, and that's a panic attack. And when it comes, you may experience physical symptoms such as racing heart, breathing difficulties, and sweating. You might have felt it once in your life. You have a sudden attack of fear. You don't even know what this fear is coming about, and you're sweating profusely. Your heart will be racing. It will be racing. Boom, boom, boom. All of a sudden, you can't even trace what is causing it. That is a panic attack. So we're saying that most people experience a panic attack once or twice in their lives. Every human being may experience panic attack once or twice in their lives. We're saying that according to the American Psychological Association, they report that 1 out of every 75 people might experience a panic disorder. A panic disorder. And the panic disorder is characterized by persistent fear. Because you have had 1 or 2 panic attacks, you have a persistent fear or worry that the attack will reoccur. And this fear or worry is consistent, it's persistent. And that's what we talk about as a panic disorder. A panic disorder. It can have terrible consequences in our lives or on our lives. We'll have the chance to explain panic disorder into more detail. What is agoraphobia? Agoraphobia is a type of anxiety disorder that causes people to avoid places and situations that might cause them to feel trapped. Okay, it is anxiety disorder that causes people to avoid places or situations that might cause them to feel trapped, helpless, panic, embarrassed, or scared. So why do you avoid these places? You fear that those situations or places, when you go there, you feel so helpless that when something happens to you, you will not have any help. For instance, people fear to even join public transport for fear of what is obvious. They fear that when something happens, they do not have help. That's agoraphobia. They even fear to be in an open space, that somebody may hate them or something terrible will happen to them. They fear to be in an open space. They even fear to be in an enclosed space. What if the roof caves on me? What if something terrible happens to me in this enclosed space? What will happen to me? That is agoraphobic. They also fear to be in a queue or in a line. If I'm there and somebody shoots me, or somebody shoots me, somebody kills me, somebody knife me, what will happen to me? So they have that fear. So people also fear to be in a crowd. So agoraphobia can be terrible. So we're saying that the anxiety is caused by the fear that there is no easy way to escape or get help if the anxiety intensifies. So if you are there and something terrible happens to you, will I get help? That anxiety, and it intensifies. Will I have help? So if the anxiety manifests in physical symptoms, will I get help? So that is agoraphobia. So most people who have agoraphobia develop it after having one or more panic attacks. Maybe you have had some panic attack before, and so you think that when you go into that situation, you may have it again. So you fear to even go in there. So people with agoraphobia often have a hard time feeling safe in any public place, especially where crowds gather. So those with this kind of disorder may have a need of a companion, such as a relative or a friend, to go with them when they're going to such places they are afraid. The fear can be so overwhelming that that person may be unable to leave home alone. They always want to go out in the company of other people. Then the last one I want to look at is what we call generalized anxiety disorders. These are anxiety disorders characterized by general, uncontrolled feelings of anxiety without a single or definitive cause source. And you have the anxiety, but you can't trace it to a single source. That is what is causing your anxiety. Many people feel anxiety every day. It has been there for a number of months, but they can't trace the source of their anxiety. This disorder might be sparked as a result of a traumatic situation, but often seems to have no source at all when it springs up in one's life. So general anxiety disorders, they involve chronic, persistent, and unresolved anxiety, often concerning everyday things that would not typically cause undue strain or stress. So this disorder is not about everyday things that may not cause anxiety or stress. But people who suffer this disorder are so much anxious about these everyday things. People with general anxiety disorders may anticipate disaster and may be overwhelmingly concerned about money, their health, family, work, or other issues of everyday life. So these people, they are so much anxious about money, so much anxious about their health, about their family, about their work, and other issues to the extent that it interferes in their performance, it interferes in their productivity. And that's what we call a generalized anxiety disorder. So people with this kind of disorder find it difficult to control their worry. You are worried about money. You don't have power over it. You are worried about your family, about your work. You don't have any power over it. Why don't worry? And that's why it's a disorder. You don't have control over your worry, and you surely need help of a counselor or a psychologist to help you overcome your generalized anxiety disorder. They may worry more than seems warranted about actual events or may expect the worst even when there is no apparent reason for concern. So generalized anxiety disorders differ from many disorders in scope, because in this kind of disorder, you can trace your disorder to a specific source, unlike panic disorder or specific disorders or agoraphobia or social anxiety disorders. This one, you can't trace it to any single source, yet you worry. So my dear friends, in this video, I have spoken about the types of anxiety disorders, and I'll explain them in detail, although not too detailed, but to help you to understand what they are. So at least you know what anxiety disorders are, and you know the types of anxiety disorders. So I'll come your way again with another video on anxiety disorders. Thanks for watching this video, and see you some other time. I am Eric Eliason, the founding director of Psychohealth Consult. Bye.